Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. You can listen live on air or on your radio that's on your counter in your kitchen or in your car. Do they still have those things? I don't know. Anyway, you can certainly listen to us also on iHeartRadio, Odyssey, TuneIn app, smart speakers, our own nccradio.org simulcast, or download the award-winning WHPC app so that you don't miss any of the shows here at WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. And today we are so happy to have as our guest Dr. Mary Shackelton. She is a naturopathic physician and an MPH and is the founder of Holistica Integrative Care and has been practicing naturopathic medicine with an emphasis on women's health for 25 years in Boulder, Colorado. What a great town that is. She also has a master's in public health, which focuses much of her work in the area of prevention. Her current focus is on environmental medicine and the conditions associated with toxic exposures, including autoimmune, chronic fatigue, cognitive decline, hormone imbalances, mitochondrial dysfunction, and neurological conditions. And she's the author of a brand new book, pretty new. It's called Preconception Cleanse. And we'll be talking about all those kinds of things today on our show. Thank you so much for joining us, Dr. Mary.
Thanks for having me, Dr. Ellen. It's great to finally meet you.
So I'm interested in the name of your book, Preconception Cleanse, because very often we are told when we are involved in something like detoxification therapies that you don't want to do a lot of detox while you're pregnant. So
Right.
Would you agree with that?
Oh, yeah, for sure, for sure. And that was the genesis of this book, is that one too many women sat down in my clinic and said, I want to get pregnant next month and I want to do a detox. And I said, you have to go away and come back in a year. You know, we really don't.
Tell us why. Tell us why.
So the point is that we store all of our toxins, just like memories. We store everything that we've come in contact with for our entire lives. And some people are more efficient at detoxification than others. So imagine once your fetal and maternal circulation is set up by week 3 of your pregnancy, you're exchanging everything you excrete with that baby. So we used to think the placenta was this magical protected kingdom that nothing could get in, but now we know differently. We know that, and in one study, they measured cord sample blood at the time of birth and found 287 chemicals in it. So we know that babies are exposed. So the whole premise of this book was that, one, I've been seeing a lot of people with cognitive decline earlier and earlier in their 40s and 50s in the course of my career, and realizing that, the brain is the most sensitive organ to toxicity, and that if women were to decrease their total toxic load before they give birth, they would pass fewer toxins on, have a better neurologically intact baby, and that sets the stage for that person's life, that they have reduced risk of autism, ADD, and anxiety.
So that's why your book's name is perfect. And you're saying to young women, and I would say at this point in time, lots of not so young women, because I've worked in a fertility clinic, and people, between 40 and 50 are coming in wanting to get pregnant, but be that as it may, you're talking about when you're considering doing that, bringing another baby into the world, that think about doing a cleanse before you start to try to conceive.
Exactly. It will also improve fertility outcomes. So a lot of what I talk about in this book, and you're right, women are really attempting conception later and later, which means that their eggs are a little bit less resilient, less healthy. That's just a fact. And so the golden time is long before you want to conceive, you want to start getting rid of your exposures to toxins, both voluntary, the things that we choose to buy and put on our skin and have in our homes, and then the things that are somewhat involuntary, which is what's in the environment. We do have control over those things. So by taking these steps, it's a process. It doesn't happen overnight. And so by taking these steps, you will reduce your total toxic load and improve your fertility outcome. There's a lot of studies about how phthalates, which are in fragrances, decrease the number of follicles that women can have, and it impairs hormonal signaling. So those two things can really be an obstacle to conception. If you know where to find phthalates, which are in anything that has a synthetic fragrance, just eliminating that can have a big impact on your fertility outcome. It's, fertility, it's kind of like what's the word I'm looking for? It's a way that we assess the health of a population, is how fertile they are. Our fertility rates are dropping. Sperm count is dropping. It's globally, not just in the United States. This is a real litmus, I guess, a litmus test of how healthy we are as a species, is that we're not reproducing as well as we used to. Or
is that true? Wait a minute. That's
yes.
a big statement.
Yes.
So tell us more about that.
That is absolutely true. So
see, I'm interested in that. I didn't know that. I thought it was because of what I mentioned earlier, that so many women are putting off parenthood so much later in, the fertility cycle.
Well, that is one factor.
Okay.
And the other factors are declining sperm count. And those sperm count changes have been directly linked to toxic exposure, to sedentary lifestyles, to poor diet, and to nutrient deficiencies. Sperm is easier to address because within 75 days, you can turn around sperm production and the actual health of sperm. For egg quality, it's a little bit more like 12 weeks. We are noticing a decrease in the number of healthy eggs that a woman has. We're seeing that they are, the number and the health of the eggs are all affected by exposure to toxins, poor nutrients, and stress. I will say there's a test that you can take that measures the true age of your cells and the chronologic age of your cells. And you want those to kind of match. You don't want to be 30 years old and have your cells be the age of a 37-year-old. There's actually a test that I'm using that we can measure that. And then we put lifestyle practices in place. We put a lot of nutrients. We do detox. And that number can shift in 12 weeks for eggs. It's kind of, one of those things women often, I talk about empowered fertility a lot. Women are disempowered around their fertility because they don't know what the options are. They just think they have to go straight to IVF if they have one miscarriage or if they can't conceive on the first time. I mean, the statistics are that healthy couples that are ovulating and have perfect sperm count conceive 20% of the time if all the conditions are perfect for conception. So women get a little freaked out when they wait too long, and then they realize they didn't get pregnant right out of the bat, and then they go straight to IVF. And so what I want women to know is that there's this entire range of things that you are in control of that can make a really big difference to the health of your cells and to the fertility outcomes.
Yeah, and so that's very good news.
Yeah, super great. It's very, our bodies are amazing, as you know, right? We have to just remove obstacles and it knows how to heal. And so for some women, those obstacles are X. And for some women, those obstacles are Z. And so we just, it's an individualized approach. It's not like there are some common things that everybody can do. But, people detox heavy metals at a different rate than they detoxify pesticides, or they may have exposure at higher levels of pesticides. And so, knowing what your particular issue is part of the battle. And then once you know, it's easy to treat.
Is the best place for people to look about this information on your website, maryshackleton.com?
Yes.
And we will have a link to that there.
My book is a how-to guide. My mission is to really get this book in the hands of 1 million women because I want to change the paradigm around how fertile women think about their fertility. And so they're more protective of it earlier on. Even if they don't want to conceive for 10 years, I want them thinking about protecting those eggs because those eggs sustain damage when exposed to certain things. And so, yes, the book is a how-to guide. You can buy that on Amazon under Preconception Cleanse and my name, Mary Shackelton. It'll pop up. But on my website, I do have a course that women can take. It's 4 modules, and it helps you kind of understand where your exposures are and what to do with them with diet, nutrients, and avoidance mainly.
Yeah, and it's so amazing. We're living in a sort of toxic soup. And has there even been some really good data on all the new electromagnetic fields that are around and 5G?
That's such a good question. Yeah. I mean, we know that our cells are exquisitely sensitive to frequencies because we can use them to heal. And so when I have 2 daughters and they sleep with their phones on their beds, I'm like, please, that is impacting your immune system, and that is going to impact your cells, and your eggs and your fertility are cells. EMFs are definitely a force to be reckoned with. And I really, the basics that I really line out for patients is to turn off your router at night. It's not about putting your phone on airplane mode. That doesn't do anything. You are still exposed to the Wi-Fi signal when your phone is on airplane mode because it's still transmitting information, time and date and texts and news notifications. So turning your computers off, turning your phones off, and turning your routers off, unplugging things from the wall like the TV and the lights, those things can create a sleep sanctuary at the very least, so that for 8 hours that you're in bed, you're not getting that constant bombardment of electromagnetic frequencies.
Well, you're talking about cleanse, and very much so. That's the name of your book, The Preconception Cleanse. And that word detox, I think, is being abused and overused. And especially I see people who are called influencers saying all kinds of things about detox, and I don't think they have a clue about what that word might mean or what they're recommending might do.
Thank you. That is one of my biggest beefs, is this word gets thrown around so easily. And there's so much misinformation. So part of my book was to dispel some of that. I do dispel the myths about detoxification, what it is and what it really looks like. And the people that are talking about this on Instagram don't have a medical background. They don't know. They just don't know. So basically, detoxification is not a water fast. Detoxification is not the master cleanse. Detoxification is not juicing only. I love juicing. I'm a big juicer, but I don't exclusively juice. I add it into my diet. Detoxification is not raw vegan eating. It looks a lot different than that. Actually, in our liver, we have 2 phases of detoxification, phase 1 and phase 2. And phase 1 takes a toxin that we're exposed to, or we metabolize something that we want to eliminate, and it puts that compound into an intermediary. Phase 2 makes that water soluble so you can excrete it. So phase 1 and phase 2 require fat, carbs, and protein, number 1, to work efficiently. And then they require a lot of nutrients. So if you're fasting, you're shutting down phase 2 detox, and things are not getting excreted. They're building up. Eating well is the number 1 way to detox. I don't believe in, when people stop eating, I just know that they might be getting a digestive break, but it's doing nothing in the area of helping you eliminate. And so elimination really starts with, there are 5 ways we detox: through the kidneys, liver, bowel, skin, and lymph. We're designed this way so that if something happens, let's say you're immobile and in a wheelchair and your lymphatic system is sluggish, you've still got the other 4 pathways for excretion. We really talk about detoxification looks like having really good bowel regularity. 1 bowel movement a day is okay, but 2 to 3 is better. And in order to have that, you got to eat a lot of fiber and plants. And so it's tough to get people to eat plants. You probably have experienced that as well.
That's true. I just want to bring our listeners up to date about the fact that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. And you can listen live or online at nccradio.org or iHeartRadio, Odyssey, or any of the podcast venues that you want. And for more information on today's guest or topic, you can email us at whpc@ncc.edu or me directly at naturalnurse.com. And our guest today is Dr. Mary Shackelton. She's an MPH and ND, founder of Holistica Integrative Care in beautiful Boulder, Colorado. And you can find more about her at maryshackleton.com. We'll have a live link to that after today's show. And we're talking about her and also her book, Preconception Cleanse. And thank you so much for being our guest today, Dr. Mary. Very fascinating what you're sharing with us about your definition, which is really the scientific definition of detox, even though that word is so blithely thrown around incorrectly.
It's so true. I'm so glad you brought it up because it is something that I really try to dispel a lot, that detoxification doesn't look like a starvation diet. It looks like 7 to 8 servings of fresh fruits and vegetables every day. It looks like good fats. It looks like lean proteins if you're not a vegetarian, or certain specific attention paid towards protein if you are a vegetarian, because protein supports detox. And so we've gotten in this pill-oriented society where people want to just take pills for everything and then superimpose that over an unhealthy diet. And you just cannot trick your body because your body knows. It's so sensitive and so wise that if you're not feeding it well, or if you're feeding it nutrient deficient foods, there's a score being kept, and it shows up in our aging, and particularly with our fertility, which is what we're talking about, is how fertility has changed and how we're in trouble. We are, I think the statistic is we need a replacement value of 2. So that means one woman needs to have 2 children in order to maintain the population where it is. A lot of people have a lot of controversy around this because they're saying the earth is overpopulated.
Right,
but in 2 to 3 generations, if we continue the way we're going, we are currently at a 1.6. Asia's at a 1.3. Europe is at a 1.3 replacement value. So in a couple of generations, we will experience economic collapse because there won't be enough young people to take care of the old people. And in terms of financial support and retirement and all that.
Now, what about, I also want to ask you, because you're very knowledgeable about environmental toxicity and the autism and ADD. How is it possible the amount of our population that is being born with those challenges at this time? We're told it's genetic. That can't be genetic.
No.
Right.
No, it is not genetic. It's kind of like, I mean, we could probably talk for a long time about this, but it's kind of like, I don't believe breast cancer is an estrogen-related disorder. It's an environmental disease. And autism is an environmental disease. And it is genetic in that there are a couple of genes that women should know about when they want to conceive that increase your risk of having autism if you have these genes. But there are things that you can do to address that, mostly through our diet, that can reduce the risk. And so, yes, the risk of ADD and autism goes up with environmental exposure to toxins. And they've demonstrated that women that live a certain distance from a freeway have an increased risk of having a baby on the autism spectrum. Women that have an increased risk or increased exposure to certain things in utero, certain chemicals, have an increased risk of autism. And so, there's a lot of controversy about vaccines causing autism. And, I think that they're involved, but I don't know that they're the only thing. I think it's the way we live. There's also this concept of vertical transmission, which is so fascinating. It is the concept of having your maternal grandmother's toxins passed to your grandmother, your mother, and then she passes it along to you, and you're passing that to your baby. So we can see this when families have, big exposure to pesticides. Let's call them farmers in the Midwest, and they've started spraying in the 1950s. And the subsequent generations are more likely to have neurologic disease because those pesticides are nerve agents and they cause neurologic damage. And so we can actually track how this vertical transmission of toxins is contributing to the neurologic issues that babies face. I mean, I never saw a kid in my elementary school with anxiety, and now pharmaceutical companies are gearing most of their drug development towards anxiety for medications for children.
It's true. And I have found really interesting when we talk in homeopathy, which, of course, the FDA is now taking completely off the market. So I suggest
I know. It's terrifying.
If anybody would like to learn about homeopathy, just buy a homeopathic kit right now and you can learn later, or it's
Do
just
it
not
now,
going to
right.
be there. Horrible. But we talk in homeopathy about things being passed down, but yet they actually have done DNA studies talking about what you referenced, Dr. Mary, about them seeing that damage done by things like pesticides and herbicides actually are being passed down. So it can become generational, but yet it's a concept that was discussed so long ago in homeopathy.
Yes, and I'm a big fan of homeopathy. I have a homeopathic pharmacy in my clinic, and whenever possible, use that. Sometimes herbs work better for patients, and we have lots of different modalities. But the principle of homeopathy really is beautiful because it knows it's relying on your body's incredible wisdom to respond to the right vibration, essentially, and that's how sensitive we are. But I will say, when I started practicing, I used to give a lot of 6C, 30C remedies, and now I don't usually use those remedies.
The lower one, yeah.
Yeah, the lower potencies don't work as well as the higher potencies now, I find, because I think we're dumbed down by all of these exposures and influences that we have.
It's true. So these are all things that you can find out by looking at Dr. Mary's book called Preconception Cleanse. And of course, that focus is especially for younger women who are thinking about becoming mothers. However, your clinic, do you only see, is it only a women-centered clinic, or do you see other people?
No, my clinic used to be called the Women's Center for Natural Medicine, and so many women would come in and say, would you see my husband? Do you only see women? And so I actually changed it to holistic integrative care to kind of treat the whole family.
Right.
So yes, we do have men there, but yes, we have, there's women are the gatekeepers of medicine in their homes and health care for their families. And so they tend to seek care more often than men. So it's probably 65-35.
Now, since our, big pandemic experience, even in Colorado, you had that. Are you seeing people virtually from anywhere in the country, or only if they're coming into your clinic?
Yes, we do telemedicine, which is such a relief. And so if you have a LabCorp in your area and we need to draw blood, we can order that through LabCorp. We can send kits for stool and urine and saliva if we want to measure hormones. It has made it a lot easier to be able to reach people in areas where naturopathic medicine may not be available.
That's true, because here, I'm in New York and in Florida, the both places I live, it's not recognized, but a lot of people practice by having their acupuncture license. So they're licensed to acupuncturists, which is legal. Right. And then they're also, a trained naturopath from Bastyr or National or one of those schools. So now what about some of the tests? What are some of the unique tests that you might recommend that people may not usually hear about?
Okay, so in my book, there's a list of the basics, but what I really have been tuning into lately is the MTHFR gene. MTHFR stands for methyl tetrahydrofolate reductase. You don't need to remember that. Just remember MTHFR. This is a gene that impacts, one, detoxification and fertility and cardiovascular disease and stroke risk. But in particular, when a woman has one or two copies of this gene, you get a copy from your mom and a copy from your dad. If one parent gave you a copy, you're methylating at 70%. If two parents gave you a copy, you're methylating at 30%, which increases your risk of miscarriage. And it increases your risk of having a baby on the autism spectrum because it impairs your ability to detox properly. So the way we fix this when we know what your MTHFR status is by giving you the appropriate amount of folate. And that's why prenatal vitamins. And form. Like correct. So folinic acid we want to avoid. We want to avoid folate. We want to know. So I was going to say that the prenatal vitamins are formulated with folate now. And this addresses all of the methylation issues that women can have. Now, dark green leafy vegetables have a lot of folate in them also. Eggs have a lot of folate. So we try to work with both the diet and the supplement. But that is one gene that's an important test to know if you're wanting to conceive. Another one that I'm really looking at lately is a hypercoagulation gene, and it's called the PAI-1, PAI-1. And this gene indicates how thick and sticky your blood is. So when you're pregnant, your blood is thicker and stickier to begin with. If you have this gene, it compounds that. And if you know that, you can take enzymes and address it, reducing your risk of miscarriage.
Wow, I love doing this. You know, I've been doing this show since 1987. Just want you to know. This one since 1991. Okay, my other show since 1987. I never heard that before. So thank you for sharing that.
I've been doing this for about 18 months. It's fairly new. The MTHFR gene, that's been on the radar for about 8 years.
Right, that was.
And it impacts lots of things, but in particular autism. So yeah, those are some things. And that's why I don't ever want women to give up, because there's always a lot available to you. And I think that empowered fertility looks like knowing all of the things that you can do to improve your egg quality. I had a woman one time respond to one of my posts like, "What's wrong with autism?" And I said, "Nothing's wrong with autism, but you wouldn't choose it if you didn't have it." You know, like it provides an amazing opportunity to learn a lot when you have a child on the spectrum, but it's difficult. And so I don't know that that's the neurologically intact spot we're aiming for. And so because my area of focus is usually prevention, I think it's worthwhile to prevent that and have a very healthy, neurologically intact baby if we can do it.
Right, if we can. And they were coming from, you know, you weren't autism bashing. You were just saying it's caused by things. And some of those things might be able to be changed rather than saying, "Oh, I don't know. I have no idea why." Half the classroom now has that challenge. It's wild. So,
or ADD.
Yeah. Exactly.
I mean, it's incredible. And I think ADD is a gifted brain, no question. But that's also difficult for kids to harness, and for them to be in a classroom and not be able to articulate what their challenges are. And, you know, so
right.
I think
absolutely.
ADD is also kind of a tip of the iceberg look at what's happening environmentally.
Well, we're going to end there, but I want to thank you so much for a fascinating show. We've been talking to Dr. Mary Shackelton, and you can find her at holisticcare.com, Mary at holisticcare.com. And
it's Holistica.
Holistica.
HOLISTICA. Yeah, Holistica Care.
And we will also have that as a live link on the archive so people can find you. So thank you so much for being our guest today.
Thank you so much. Great to finally meet you.
And thank you, listeners, for tuning in to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.